Hello, I'm Dr. Sonal Kumta. I'm the gynecologist and obstetrician at the Fortis Hospital, Mulund. And today I'm going to talk to you about what you should know before you become sexually active. As you know, there is a huge build-up, to the first time one has sexual intercourse, and hence there are lot of anticipation, lot of anxiety, and hence lot of myths and misconception also about what you should be aware of. According to me, the two most important things is one should be aware and one should be careful to prevent against any infection, transmission of sexually transmitted infections. And the second most important thing is one must be aware that when you are in a heterosexual relation, one can get pregnant. So these are obviously the two most important things that you need to be aware. So what can you do to prevent infections? Well, hygiene practices should be followed by both the partners, and I will definitely encourage that condoms must be used while having sexual intercourse so that the risk of transmission of any infection is down to a minimum. Also, if you know that you are harboring any kind of infection at that time, be it a urinary tract infection or a fungal infection, it is always better to avoid intercourse at such a time. How can one prevent a pregnancy when you are going to be sexually active? Well, it is very important to know the physiology or your reproductive cycle. As you are aware, the ovulation happens around the middle of the cycle, that is around the day 14, 15, 16 of the menstrual cycle, and hence it is very important to avoid intercourse at this time and preferably have intercourse either closer to the menstrual cycle or after the 20th day. Now, it's not enough to just not or have intercourse during the safe period, but it is always better to have thought about birth control practices much before when you think you will be sexually active. So I would recommend all of you to definitely meet up with a gynecologist and discuss all these. What are the different options? What are the contraceptives available, like birth control pills, or they may be injections for birth control, or barrier methods, or they could be implants, or so many other contraceptive options that are available before you become sexually active, so that one can safely prevent a pregnancy. Also, it is important to know that there is something called as an emergency contraceptive, or what is known as a pill which can be taken in case you do not practice safe sex and you want to avoid a pregnancy. Now, this is called as a emergency contraceptive. It is over the counter and it is available in any chemist store. The tablets should be consumed by the woman at the earliest of having an unprotected intercourse, and definitely within 72 hours. And you can of course meet with us, meet the gynecologist to get more information about all these options. Now, a lot of people also are very worried before having intercourse that, doctor, is it going to be very painful? Am I going to have a lot of difficulty while having intercourse? So let me tell you all that intercourse is not painful per se, but whenever you are very tense or anxious, definitely lubrication is not going to be as much, and hence intercourse may cause a little bit of pain or burning. But as you get more comfortable, as you are more aware of your and your partner's bodies, it will definitely get more and more comfortable. And we also recommend a counseling with a gynecologist where the two people concerned can come and discuss whatever problems one may have encountered, and we can help you become more aware of the anatomy so that you can have intercourse without having any pain. So as I said, these are the most important things that you need to know and be aware of before being sexually active.